Welcome to the Her Story Circle podcast, the podcast that brings you the extraordinary tales of everyday women who are changing the world. I'm your host, Gertrude Mache, and I'd like to acknowledge traditional custodians of the land on which we meet today. I also like to pay my respects to elders, past, present, and emerging. Every week, we dive into the lives, challenges, and triumphs of women from all four corners of the globe. We're here to inspire, enlighten, and connect, sharing stories that uplift and empower. So grab a cup of coffee, settle in, and join us as we explore the incredible journeys of women shaping our future. This is Her Story, where every woman's voice matters. Hello, everybody, and welcome back to the Her Story Circle. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another brilliant woman. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, and share your story with us today.
Well, hello, everyone, and thank you so much for having me on your show, on your podcast. My name is Dr. Kimberly Lee, and I'm a facial plastic and reconstructive surgeon based in Beverly Hills, California, USA. I am the only child of immigrants to the U.S., and I grew up in San Jose, which is right near Cupertino in the Bay Area. I was born in Mountain View, California. I grew up in the Bay Area my entire life. And I graduated from Stanford University for college and Stanford University School of Medicine for my medical degree. I then went to UCLA, where I did my residency in head and neck surgery, followed by fellowship training in facial plastic and reconstructive surgery. After that, I have my own private practice based here in Beverly Hills, California. I'm also part of the medical staff at the famous Cedars-Sinai Medical Center here in Los Angeles. And I really am very excited to be part of your podcast today. I have a pretty busy lifestyle. Not only am I a plastic surgeon, but I'm also a mother. I have twin boys who keep me pretty busy. And I'm very active in my community, in the hospital, with training residents in the community, whether it's attending to patients who've been victims of domestic violence. And in terms of reconstructive surgery, I've had a couple of really exciting and unusual patients and cases in my career thus far that have brought a lot of media attention. More significantly, or more specifically, I should say, I have had a patient whose face was mauled by a bear and was airlifted to the hospital, where I reconstructed her face. It was a huge story at the time. It's not common to have somebody survive a bear attack, but this woman was miraculously survived and could live to tell the story. And I was fortunate to be part of that journey in reconstructing her face. So anywhere from trauma of that nature to traumatic events where I've had a 3.5-inch nail go up a person's mouth that I had to remove, to my unique stories of helping other women who've undergone facial plastic procedures. I recently had a patient who came in for a facelift and a neck lift, only to find that a small lump in her neck came back to be cancer. And when these things happen, it's really important to me, being female, being a woman, that we stand by our patients and stand with them through this journey until we can get them the help that they need. And I'm very happy to report that this patient has survived and is in remission. And thank goodness I was able to remove all of the cancer that was in her neck. So in her case, her plastic surgery actually saved her life in that respect. My expertise is really focused on the face and the head and neck region, but it's also involved in skin care and facial paralysis and ethnic plastic surgery and head and neck cancer reconstruction. I'm very excited to be here, and I'm happy to share my experience and my journey being one of a small cohort of 15% of facial plastic surgeons who are female.
Dr. Lee, you have had a fantastic journey with your career. And really, it's inspiring to see you inserting yourself into a field where there's only 15% female surgeons. What was the inspiration behind you selecting or choosing a career in facial plastic and reconstructive surgery in the first place?
Well, that's a great question. And I think part of it is I wanted to do something that I was really interested in and that I knew could help people. I know that a lot of surgical subspecialties are very male dominant. And certainly when I was going through my training, that was the case as well. But I also am part of the school of thought where we should do things that we love to do, because then you'll excel at it because you love to do it. I'm also of the school of thought that just because we're female doesn't mean we can't do something just as good as our male counterparts. And I think by being female and having female patients, actually both female and male patients, but when you have these female patients, they're talking about insecurities, and it's often something they don't really want to talk about, much less discuss with a man who may or may not even understand where they're coming from. So I think that's a unique perspective. I feel like a lot of our patients I connect with and can understand where they're coming from. I understand their fears, their insecurities, their desires. And I think that's something that drew me to this field. I also like that we're very specific in the face. That's one of our biggest assets, but it's also an area where there's really no room for error.
Now, what are some of the biggest challenges that you faced as a woman of color in the medical and surgical world, and how did you overcome them?
Well, I think first of all, being female, that was a little bit challenging because surgery in general is traditionally a male dominated field. So that in and of itself is one of the challenges. You don't get any passes because you're female to get to go home early or to do things less than your male counterparts. So you are expected to do things exactly the way anyone else would. I remember in my residency, there was a female resident that we had, and she was extremely pregnant. I mean, I think she was close to giving birth. And yet, whether it was 12 midnight or 1 a.m., she was still in the hospital taking care of patients. And I think that those can be really challenging times. I was fortunate in that I was not pregnant during my residency, but those are really challenging times. And I think that it shows the strength and the resilience that we as women have to be able to train and do the same things like our male counterparts with a slightly different perspective.
Now, you mentioned that you worked on some really high-profile cases, including the woman who was mauled by the bear in Kern County. Can you share more about that experience and the impact it had on you as a surgeon?
So I think first of all, things happened really quickly with this woman. So she is a very petite woman. I think she's less than 100 pounds. And she was outside her house when she came face to face with a bear. And this bear grabbed her by the sides of her face and I believe she said he was trying to eat me.
Oh.
She's a really smart lady. And if you ever met her, you would say she's really smart. She, in that moment where there's a bear staring at you, she was smart enough to think and put her thumb in the bear's eye. And when she did that, for that split second, the bear let go of her and she was able to call her huge mastiff dogs over. And the dogs were able to basically take the attention of the bear away from her, during which time she escaped. She escaped into her car, and she said, I felt like I had a baseball cap or something. And so she said, I'm going to give myself one look in the rearview mirror, just one look. And that's it. So she thought this was her cap, but it actually was part of her face.
Oh, wow.
I think it shows her strength in that she turned on her car. She was fishtailing down dirt paths. She could barely see, and she made it to, I think it was the sheriff's station. She said, I looked at this guy. He looked like he was going to pass out. And she thought, I don't know if this guy can really help me. So she said, please call ahead to the fire station. Get a helicopter there. She gets in the car and she's thinking, I don't know about this guy. I don't know if he's really going to be able to do it. But she started driving. She got to the fire station and he had called ahead. So there was a helicopter waiting for her. They transported her to UCLA Medical Center, where I was at the time. She came into in the helicopter. The reports were that she was rattling off her medical record number. She was telling them all her allergies, all of that information that we normally ask of any patient. She was giving that information. And she came in bandaged to the emergency room. By the time I saw her, she was in the CT scanner. And I saw the CT scan before I actually saw her. She was already put under anesthesia. Right. And you could tell that it looked really bad. I mean, this is something really bad. In the trauma suite, in the operating room, it was the first time I took off the bandages. And it was really bad. I mean, you can only imagine how bad this would look after being attacked by a bear. And in fact, in the bone of her forehead, you could see where the claw had actually torn through that bone. So there's an imprint or an indentation. I mean, this is a very traumatic event. I didn't know what she looked like beforehand. I had no idea, had no opportunity to speak with her. So all I could do was put her back to the best of my ability by trying to put the tissues together. Right. And I mean, there were cuts like in the cheeks. So when you were looking at the outside of her face, you were actually looking at the inside of her mouth. I mean, this was pretty traumatic. So I did the surgery. We did the best that we could. And I'll never forget the following morning when we went to round and see her in the hospital. I was actually pretty scared. And the reason I was scared was I wasn't really sure how she was going to react. I mean, what if this lady says to me, hey, doctor, why didn't you just let me die? Like, why did you fix me? I mean, I don't know how she's going to respond, but I was really surprised and happily surprised that she was ecstatic. She was so happy. And she said, oh, I'm so happy with the way I look. Thank you so much. You know, are you the one who did this? Thank you so much for doing this for me. And she has this really positive outlook on life. She's healed incredibly well. You would hardly even think that she's ever undergone this traumatizing event. And so I think these are the situations and the cases that really validate the training and all of the things that we've gone through to get to the stage to be that surgeon. Because this was life-changing for her.
Yeah.
And it was a huge event in her life, one she'll never forget. But to be able to be a part of that journey and help that person and help put her back together, I think was huge. And that's one of the things that I love about being a surgeon. It's one of the most gratifying things that we can do as surgeons, which is really to see the fruits of our labor right then and there in those types of instances.
That's just an incredible story. So, what is your approach to achieving natural results in facial rejuvenation? What sets your work apart in your field?
Well, for me, I always put myself in my patient's shoes. So I always think, if this were my face, knowing what I know, what would I want? What would look natural? And what is it that the patient is looking for so I can guide them? So my signature is, I really want you to look rejuvenated, but I don't really want you to necessarily advertise that you've had something done. So if you're on a street corner and somebody who doesn't know you sees you, they should think, wow, Gertrude, you look great. But they should never think, oh, that lady went and had something done. So that's really the goal of what I do. And sometimes I get patients who come in and they say, I want every line and wrinkle gone. I want them all gone. Well, all gone does not necessarily mean you're going to look great. Sometimes having no wrinkles makes you look kind of weird. So I think it's important to be age appropriate. And in order to achieve natural results, it's really important to look at the patient's face, look at their proportions. You really have to look at the bigger picture here. And give them a balanced result that matches their face. So what's good for one person's face may not be good for that person's face, because you have different features and different proportions. And so I think that's the important thing to help guide these patients.
I love that. Now, plastic surgery is often stigmatized. What misconceptions do you think people have about it, and how do you address them?
Well, plastic surgery in general is a very personal decision. And so I view my role as never to tell someone that you need this surgery or you don't need. It's never a need usually. I won't say never. It's usually not a need. It's usually a want. And so it's important that I ask the patient, why do you want to get this done? And if the answer is something like, well, it's something I've thought about for a long time, I just want to, just refresh myself a little bit, that's a different answer than somebody saying, well, if I do this, I will get a better boyfriend or a better husband or a better job. Those are not usually reasons for getting plastic surgery, or ones that can be guaranteed for getting plastic surgery. And so I think it's important to understand the why. And from the why, we then determine what it is you're looking to achieve and whether or not that's achievable. Because sometimes a patient will come in and say, I want to look 30 years younger. And I will say to them, you know what? That's not going to look right. It's going to look a little weird. So I would not advise that. And if we can't really see eye to eye aesthetically, I'm not the right surgeon for them.
Right. That's wonderful. Now, with social media influencing beauty standards, how do you help your patients set these realistic expectations for plastic surgery?
That is a great question. With the advent and popularity of social media, a lot of changes have come through in the plastic surgery community. So first of all, there's a lot more awareness of different types of procedures. They're seeing people get things done. They're seeing a lot of befores and afters. People are sharing their journeys. So it seems a lot more tangible in the sense that that they can achieve these types of results. However, not everything you see or read about is actually accurate or true. So everyone's a little different. And it's really, really important that as a
Yeah.
consumer, they seek out experts in the face, experts in plastic surgery, those who are credentialed, who can guide them and tell them all the things that a procedure or a treatment entails. And that includes any complications that are possible. So I think those are really important points that are often they're often overlooked, like, oh, this is so easy, or oh, I'll never have a complication, because they think it's a little bit too common.
Now, you're an advocate for educating and empowering others. What advice would you give to young women who are aspiring to break into male dominated fields?
So it's funny you asked this question, because I've been a mentor for a foundation where we have a lot of high school and college students come every year. And
Oh,
the mentor day is actually a really fun day. They bring in leaders from all of the different fields and specialties to talk to these young people. And at my table every year, I get tons of young women. I do. And they're always asking me, like, how do you be a surgeon and a mom and do all these things? My advice is always the same. It's always look within yourself to find what it is that you love. Because if
right.
you truly love what you do, you're going to be great at it.
Yeah.
Okay, that's the first thing. And the second part of that is, don't ever let anyone tell you you can't do something because you're female, because
Mm,
you can. And in fact, you could probably do it better than the next person. So it's
yeah.
important to believe in yourself and to help achieve your dreams. And no
Mhm.
one can take away your dreams or tell you you can't do something because of X, Y, or Z reason.
I love that. That's really good advice. Now, are there any new technologies or advancements in facial plastic surgery that excites you?
I think our field is constantly evolving. And so I would say over the last few years, we're doing a lot of less invasive techniques, a lot of less invasive procedures. So you'll hear about thread lifts, you'll hear about procedures that we do in the office, like buccal fat procedures or dimple creation or earlobe repairs. And then you'll see that we have also modernized our surgical techniques. So, for example, our face and neck
Mhm.
lift surgeries, these are not the same surgeries we did for your grandmothers. Now we've become very sophisticated with our techniques and our instruments and the way we do things, and that we're doing facelifts on younger women because we're not looking for correction of aging. We're looking to prevent aging. So we've had a shift in that paradigm where we don't want to get old and then look younger. We just want to look young all the time. Okay. And so that
Yes.
entails sometimes doing less invasive procedures to just age gracefully. And
Wow.
I think we've had a lot of advances in skincare, a lot of advances in, even our dermal fillers. Back in the day, we only had two different types. Now we have a whole smattering of different kinds, and they have
Mhm.
each individual techniques and properties that are a little bit different. So everything looks a little bit more natural. And I
Right.
know that in our field, we will continue to evolve to meet the demands of our society and our women.
So, what are some of the self care or skincare tips that you recommend for people who may not be ready for surgery but want to maintain that youthful skin?
So the skin is our largest organ, if you think about it, and we only get one face. So you better take really good care of it. Okay. Um, so I like to really stay on top of the latest advances in skincare. Everyone has
Mhm.
slightly different needs, so it's important to understand your skin type, whether you're
Mhm.
oily, combination, dry, and tailor your skincare regimen towards your needs. So a
Right.
couple of things that I personally do is, at night I actually do a double cleanse. So I don't just wash my face once. I do it with an oil base followed by a non-oil based cleanser to make sure all of whatever I was wearing during the day is gone and off. I like
Mm-hmm.
to do a few different serums. So I like serums that have firming collagen in them. I like serums that are anti-wrinkle. And then for me, I tend to have a little bit of a drier skin. So I like using creams that have a high concentration of hyaluronic acid, but aren't so thick because then it feels like it's too heavy. And I don't really like that. During the day, the non negotiable is the sunscreen. And I always recommend that we use a um, physical block. So not a chemical based sunscreen that actually
Mm-hmm.
goes into your bloodstream and then tries to prevent the effects of the sun. But I like the actual physical block that will prevent the sun rays, the UVA and UVB rays from actually damaging your skin. So that's the non-negotiable. Um, I actually don't wear foundation or I don't really wear a lot of makeup. I just do a little bit of BB cream and I like to be very natural. I like to keep it very easy because I'm so busy and I'm on the go all the time.
That's really good advice for anyone, really. Now, you've been featured on major media outlets like People Magazine, The Doctors, The Extreme, Doctor 90210. How has this media exposure influenced your career and your practice?
I think initially when I had the bear attack, it
Right.
was very empowering for me because I was at the end of my residency. I was a chief resident at that time, and I had a
Okay.
lot of really important decisions to make. I
Mhm.
knew that I wanted to have a family. And I knew that I wanted to have flexibility for that family. So I knew that was my end goal. I just didn't really know which path I was going to take. So I had the
Right.
opportunity to go into academics. I had the opportunity to join practices that were already established or hospital based practices.
Yes.
But the bear situation and the sort of media exposure from that actually was something that gave me the confidence to actually go on my own and start my own private practice.
Mm.
Because I
Wow.
think when you're thinking about starting your own practice, it's a little bit daunting.
Yeah. Yeah.
It's not something that they necessarily teach you how to do, for example, but I think it also gave a little bit of validation as to what my skills were and what I could achieve for people. But ultimately, for me, it was I wanted the flexibility for this family I was going to have down the line and
Yes.
also the flexibility with my patients. So I wanted to have the autonomy to spend time with each and every one of my patients and
Mm.
not be limited to a certain schedule. For example, some hospitals or practices will say you have to see a patient every 15 minutes.
Yes.
I didn't like that constraint because
Mm.
sometimes patients have things that they need to talk to you about, and you can't
Yeah.
fit them into a 15-minute window. It just doesn't happen.
Mhm.
And
Mhm.
so I really think of my patients as my friends and family. These are people I truly care about. And I've been very fortunate in that the majority of my patients are people who I would consider to be friends and family. And so for me, going back to your earlier question of what advice would you give? It's really find what you love to do and then do it.
Last question is futuristic, and I'm going to teleport you into the future.
Mhm.
And we're going to go and sit with the 90-year-old you.
Oh,
And
okay.
in her rocking chair, surrounded by her children, her grandchildren, with science and technology, you'll probably be on a dance floor learning some new steps. But if I could teleport you into the future to meet this amazing woman who has led you up until this point, what will you say to her when you finally meet her?
Wow. Well, I guess I would want to look back on my life and not have any regrets. I think that's really important. So sometimes we have to take a little bit of leap of faith. We have to believe in ourselves. We have to think about where we're going and how to get there. But ultimately, I think the most important thing is when I get to the age of 90, I want to make sure that I did everything I possibly could and that I don't have any regrets at that point. I think that for me is a really important thing. I think that it's important to surround ourselves with friends and family, but also to be able to empower other women, empower the next generation, and to help advance our field, our society, our community around us.
That is absolutely wonderful. Dr. Lee, thank you so much for coming online and sharing your story with us today. It's always inspiring to see women who are on the cutting edge of technology and science, leading the way and showing young women what is possible. Thank you for your work.
Thank you so much for inviting me to be on the podcast. It truly is very amazing to see all of your guests and learn from their stories as well.
And thank you to everybody who tuned in today. The Her Story Circle is not just a podcast. We are a social impact movement that is writing women's stories into history. We share our stories to uplift you, inspire you, energize you, but most importantly, to take you from where you are now to where you're trying to go. So today we've brought you an amazing professional who is talking about longevity, how to stay young and fresh and take care of yourself so that you can end your days looking good as well. So I'll be back again tomorrow, everybody, with yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world. And Dr. Lee, thanks again for the interview.
Thank you so much.
Bye for now, everybody. Thank you for tuning into the Her Story Circle podcast. I hope today's story has inspired you to believe in the power of our stories and the difference you can make in the world when you use your voice. I'm Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a rich tapestry of diverse perspectives. Don't forget to subscribe, rate, and review our podcast to help us share these stories with more listeners. Follow us on social media by looking for the Her Story Circle podcast for more updates. And join us tomorrow for another episode filled with courage, resilience, and empowerment. Remember, your story matters, and together we're building a stronger, more inclusive world. Until next time, keep making